you are all doing well. So today let me try to make your life a little easy. Every day I'm taking classes asking you difficult MCQs where you are feeling, oh my god, I know so little. Let us try to make your life a little easy today. Today I will be teaching you more than asking you. And today we will be discussing some important scores in the hepatobiliary system. Okay, so let's try to cover the basic ones, the standard ones, as well as the important ones in a structured pattern, some with the help of some mnemonics and some tricks to remember. They are extremely useful not only for NEET PG but for undergraduates, for writing answers, practicals, and in your life. Okay, and you're not going to keep revising, so we need a little simplified way to remember at least the important basic scores affecting liver and other biliary disorders. Okay, so I hope you guys can see me and hear me clearly. This will again be a short class just like the one I took a little while back on pancreatic severity scores, which you must see if you haven't, as well as this class. This will again be a short class, but I want to cover the important scores. Those of you coming for my class for the first time, I am Dr. Amrit Nasta. I am a surgery educator on the Unacademy platform, and I am a bariatric surgeon from Mumbai. If you wish to learn more from me, please download the Unacademy Learning app. You can follow my profile where you'll get regular updates about my upcoming classes as well as the profile of a lot of educators teaching on the platform who will help you with your preparation for all the upcoming entrance exams. A lot of batch courses have started in the month of March to help you with prepare for entrance exams like NEET 2021, FMG 2021, INI-CET, and so on. If you wish to learn from these wonderful educators, subscribe to Plus and remember to use my referral code, that is 10 Surgery. 10 Surgery will get you a 10% discount on your Unacademy subscription. Also, on the platform, we regularly take special classes which are absolutely free. And my next special class is tomorrow at 4:30. Okay, that's my next special class tomorrow, high yield MCQs in surgery. Make sure you come for it. I have kept some amazing questions on trauma, hepatobiliary, general surgery, and so on. So do come for that. Also make sure you use all these free test series. They are on the app, they are free of charge. They give you good practice for your exams. If you are planning to subscribe, there are two subscription plans. One is the Plus plan, other is the Iconic plan. Plus plan, you have live classes like we are having now, but with a very small batch. And of course, you get better chance to interact. There are batch courses, there is a proper schedule. If you wish to get more, if you are targeting exams next year, go for the Iconic plan. Iconic plan minimum duration is 1 year where you get this benefit of Plus as well as Prep Ladder with recorded video lectures, handwritten notes and much more. So if your exam is next year, do take a 1 year subscription and remember to use this referral code, that is 10 Surgery. If you are targeting an exam in this year, take a smaller subscription plan if you wish to learn on the Plus platform, and this is the code to use. And whatever plan you take, you get a 10% discount with 10 Surgery. Okay, so that is about our platform. Now coming to our class, there are some basic scores, some basic things that we need to know which are a little hard to memorize. Let's try to make your life a little easy. Okay, do reply to this in the chat box. I can see your messages on chat, and this was one of the easiest questions of NEET PG 2020. So last year they asked this question, which surprisingly students struggled with. Now it is unpardonable if you struggle with child score, okay, or child's pug turcot or child turcot pug or modified child. They are all the same. Okay, some students told me, sir, they asked child pug turcot, is it the same as child score, is it the same as modified child score? They are all the same. Okay, there is only one child score, so let us not be confused. There is only one GCS, Glasgow Coma Scale. There are no modified Glasgow Coma Scale. Okay, so ऐसा चीज है, I भी take it as the conventional GCS. Similarly, take it as the conventional child score. So, what is the child score of this patient? His bilirubin is 2.5, albumin is 3, INR is 2, he has mild ascites, He has no encephalopathy. Otherwise, Joshi says A. I will make your life very easy. After today, calculating the child score will never be a problem. You will never have any worry about child score. Just like in the class on pancreatitis, we made Ranson score very easy, right? Always do blood sugar. You remember this? 48, half of 48 Chobis, life is sorted. Similarly, child score, I will give you a mnemonic so easy and we'll make a table with a few tricks and your life becomes easy. Okay. बस दो लोगों की जवाब दिस इज इट्स अनपार्डनेबल टू गेट दिस क्वेश्चन रॉन्ग अनपार्डनेबल सो अद्वैत पृथ्वी दोनों ने अलग आंसर दिए मे बी बोथ ऑफ यू वन ऑफ यू इज करेक्ट और मे बी बोथ ऑफ यू आर रॉन्ग डेफिनेटली बोथ ऑफ यू आर नॉट करेक्ट सो इट्स अ डिजास्टर all right okay I will give you the answer let us first try to get a grip on what is the child score first things first child score के components क्या है what are the components there are 5 components and each component now you make the table the way I am making to help you remember okay you make the table the way I am making from up to down you write this A B C D and E and on the row you write 1 point 2 point 3 points okay there is no zero in child's scoring system the score is 1.2.3 points this is the score okay there is no zero that is the only place where you should not get confused is it 0 1 2 or is it 1 2 3 it is 1 2 3 and there are 5 components so let us be very sure the maximum score that the person will get will be 15 and the minimum score that the person will get will be 5 because there are 5 parameters so let us be very sure this is how you will start drawing now A B C D E A stands for albumin of course liver albumin bilirubin now the C please remember ये जो C है it's to do with liver it's not creatinine huh? It's not creatinine creatinine is a part of some other liver score the C here is coagulation okay don't be confused the C here is coagulation it's not creatinine or what we can call as INR or PT I suggest use INR easier to calculate D is distension or ascites and E of course is encephalopathy ABCD okay not so difficult but remember the C here the C is where you will get fooled C is not in this score coagulation hai, not creatinine creatinine is the part of some other liver score now first one is the normal remember one is going to be normal 2 will be little deranged 3 will be very deranged that's how the score goes now what is normal albumin in a normal person you will say more than 3.5 gram percent normal bilirubin is going to be less than 2 milligram percent normal INR in a person now all normal values so you should know is going to be less than 1.6 INR is less than 1.6 this is normal ये तीन तो आपको मालूम होने चाहिए फर्स्ट एमबीबीएस से normal albumin normal bilirubin normal INR ascites normal person should not have any ascites he should not have any encephalopathy तो ये हो गया normal now how do I get these ranges so I will draw a line here because here I need ranges to remember now simple way to remember the range okay simple way to remember the range the fraction or the value that will vary for albumin is going to be 0.7 for bilirubin is going to be 1 and for INR is going to be 0.7 बस इतना ही याद रखना है in the whole child score the only thing you need to memorize is the ratios or the fractions 0.7 1 0.7 what do I mean 2 becomes 0.7 is the fraction so it will be 2.8 to 3.5 this is 2 points and 3 will be less than 2.8 आ गया easy understand as the disease is becoming worse the albumin is going to reduce ये फंडा आना चाहिए albumin will reduce bilirubin will increase, INR will increase as the function is deranging. So let us be very clear, the factor is going to be 0.7. So more than 3.5, 2.8 to 3.5 and 2.8. So this is a factor to substitute. Bilirubin less than 2, 2 to 3 and more than 3. Coagulation, again, as the function is getting more and more deranged, the coagulopathy will increase, the INR will increase. So this is going to be 1.6 to 2.3 and more than 2.3. Bus. That's all. So what are we remembering is these three numbers. Okay. Alternate है 0.7, 1.7. बस ये तो सबको मालूम है. Ascites, no. Ascites which can be medically controlled. I am sure you know this. Encephalopathy which can be medically controlled and uncontrolled or refractory. That gives you your child score. 3 plus 5, 8, 5 minus 3, 2. बाप रे कितने नंबर याद रखेगा? MKK, this is easy, very easy. ABCDE 1 2 3. You need to know normal values. वो तो किसी को नींद से भी उठाओगे तो नॉर्मल वैल्यू आएगी. यू आर इन फाइनल MBBS और यू आर इंटर्न, नॉर्मल वैल्यू तो सबको आते हैं, खाली ये फैक्टर याद रखना. ओके, नाउ कम टू द क्वेश्चन. Bilirubin is 2.5, which means it's between 2 and 3. He gets 2 points for this. Albumin is 3, which means it is between 3.5 and 2.8. So it's again, he gets 2 points for this. INR is 2, again he'll get 2 points for this. Ascites is mild, again he gets 2 points for this. No encephalopathy, he gets 1 point. What is the total score? 2 to 2 to 1. Total score is 9. Now 9 is what? A, B or C, ये तो आना ही चाहिए. A is going to be 5 or 6. The best score will be A, the least score is 5, so 5 or maybe 6. B is going to be 7 to 9. C is going to be 10 to 15. And D करके तो कोई score होता ही नहीं है. D is demise. So this is A, B, C. Answer is child's B. Okay, 9 becomes child's B. No, 10 and beyond is C. Not 9 and beyond. 10 and beyond is C. 9, some people also call 9 as late B. Okay, there is something like early B and late B. Some people call 9 as late B. So अपने काम का नहीं है, अपने को तो A, B और C चाहिए. ये देख लो टेबल पृथ्वी, ये टेबल ही है. So this is your A, B and C. ये टेबल मैंने नहीं बनाई, ये ऑनलाइन है. Okay. Yeah, you marked correct. Absolutely, B was correct. But I hope you marked it correct by calculation, not by fluke. I never said wrong. I said one of you is wrong or both of you are wrong. ऐसा बोला मैंने. Okay. I said one of you is wrong or both of you are wrong. Definitely both are not correct. That's what I said. Alright. Any doubt in this? This is the kind of table which is intimidating. We wonder how will we remember. This is the way to remember. Okay. A, B, C, D, E. Now coming to another classification called Todani classification, which a lot of us feel we know, but I will give you a simple, very easy trick to remember Todani classification. Todani, of course you need to know, Todani has 1, 2, 3, 4, 5, and in 4 there is A and B, and 5. ये तो सबको पता है. Correct. Now what is 1, what is 2? Let's say I give you a type of choledochal cyst where, okay, I will just show you and then you will tell me the type. So this is the gallbladder, this is the CHD, this is the CBD, and I'll give you the image. The image looks like this. This is the choledochal cyst going into the duodenum. What type of choledochal cyst is this? 1, 2, 3, 4, 5A. 1, 2, 3, 4A, 4B or 5. ये कौन सी type है choledochal cyst की? Either you will get an image like this, a drawn image, or you will get a CT or MR image, but it should be a clear image, or you will get a description. इफ यू गेट अ डिस्क्रिप्शन तो लाइफ सॉर्टेड है, पर अगर डिस्क्रिप्शन नहीं है तो भी आना चाहिए। तो ये कौन से टाइप की कोलिडोकल सिस्ट है? आई होप यू नो टोडानी क्लासिफिकेशन इज फॉर कोलिडोकल सिस्ट। अगर वही नहीं पता है तो बहुत गड़बड़ है। यस, दतेश says type 2. Why? What anatomy is this of the coledocal cyst? What is the anatomy? हाँ, क्या है ये anatomy? Why type 2? हम्म, बोलिए। Saccular. This is saccular. Oh no, this is not a sac. Sac means aneurysm. Sac is like this. Boss, ऐसी गड़बड़ ना करना. This is saccular. This is not saccular. This is something else. Saccular ऐसी होती है। ये कौन सी टाइप है? किताब में देख के मत बोलना कोई। Advait, absolutely right. This is called diverticular type. This is a diverticulum. Meckel's diverticulum, Zenker's diverticulum. This is a diverticulum. Absolutely right. If you know the scientific terminologies, then you know what it is. This is diverticulum. Now, easy way to remember. Okay, just write it like this. Put two dots. One Cooper put one dot. Two Cooper put two dots. What does that mean? One with a dot means it is an eye. In type 1, there will be single eye. Single eye means what? Fusiform or cystic. They have one eye. If there is one eye, it is type 1. Type 2, it should have two eyes. Type 2 is what? Diverticular. ये मेरी खुद की mnemonic है, so don't laugh at it. It will make your life easy. Okay, if there is some other way of remembering, you please use that. Diverticular, there are two eyes. Two eyes, type 2. Okay, now 3. 3 don't make it as I. 3 make it as just cross a line across. So it becomes a letter E. And since it is type 3, 3 E's. So there should be 3 E's in type 3. What is type 3? Intraduodenal, better. Type 3, 3 E's. What is type 3? Which has 3 E's inside it in the word. It's called choledococele. Choledococele. Now this choledococele has 3 E's. I नहीं है उसमें E है. 3 E's, choledococele, type 3. Easy. Never in your life. हर बार MCQ उस पे पूछते हैं. What is choledococele? What type? So choledococele, type 3. Okay. 4 and 5 are easy to remember. 4 and 5 are diffuse types. ये तो आने चाहिए. 4 and 5 are diffuse. A भी diffuse है, B भी diffuse है, 5 भी diffuse है. Now, what do we need to know? Diffuse 4A. Remember, A stands for the word and. A for and. So in 4A, you will get diffuse intrahepatic and extrahepatic. So if the dilatations of the choledochal cyst are in both places, the dilatations are outside and in the intrahepatic bile ducts both, that is going to be 4A. Remember, A stands for and B, it will be only extrahepatic. It will be only extrahepatic. तो उसमें सिर्फ extrahepatic biliary tree is going to be diffusely dilated. What is the other name for type 5? Other name? What is the other name for type 5? What is the other name for type 5? Yes. Yeah, what is the other name? मालूम होना चाहिए. Other name for type 5? Caroli, absolutely right. So in type 5, only intrahepatic are dilated. So type 5 is diffuse intrahepatic, also called as Caroli. Why is it called Caroli's disease? Any idea? Don't say that is the name of the person. Why is it called Caroli's disease? Because type 5 was discovered the last. It was discovered by Caroli. It was the last one to be discovered. And it was discovered last because these people don't behave like actual choledochal cysts. Okay, these are rare types and these are unusual types. That's why it was discovered very late. That's why the person gave it his own name, Caroli's disease. Because diffuse intrahepatic, they are not very common and they don't behave like true choledochal cysts. Treatment is also very different. That's why it is type 5. Okay, so let's be very clear. Type 1, single eye. Type 2, two eyes. Type 3 will have 3 E's. Choledococele. 4, 5 are going to be diffuse. A for and. So intra and extrahepatic. Alright, absolutely clear. Any doubt? This is my own creation. You will not find this in any book. Me and my wife came up with this. My wife is the queen of mnemonics. So she kind of helped me come up with this. And this is the actual Todani classification. Liver transplant, yes, liver transplant, and they behave very differently and they are not very common. That's why it was discovered very late. Now, other scores in liver and gallbladder, I just want to discuss one that is called Tokyo classification. So, there are two treatment options. One is sphincteroplasty, where you excise and suture, which is not done anymore. Other is ERCP and sphincterotomy. The idea is when I do sphincterotomy, the cyst will become draining cyst. So there will be no stasis. That's why ERCP with sphincterotomy is the current treatment modality. What I want to discuss is Tokyo classification of acute cholecystitis. And I'm discussing this because we just did acute pancreatitis. Similarly, there is acute cholecystitis. Again, it's the same. Mild acute cholecystitis, moderate acute cholecystitis, severe acute cholecystitis. But this is for cholecystitis, not for pancreatitis. This is not for gallstones, huh? This is for inflamed gallbladder, usually due to stones. So what is severe acute cholecystitis? Just like acute pancreatitis, there should be organ failure. There should be organ failure. Organ failure means severe. In pancreatitis, the word was persistent organ failure. I hope you remember. It was persistent. But यहाँ पर persistent की ज़रूरत नहीं है. Any person with cholecystitis who has organ failure, renal failure, or lung failure, respiratory failure, cardiac failure, severe acute cholecystitis. Moderate here implies only local complications. Only local complications. Perforated gallbladder, empyema gallbladder, gangrene gallbladder, they are all local complications. So understand, even gangrene is only moderate, it is not severe. It's not severe. And mild means again same, no organ failure, no local complications. Just like modified Atlanta. Easy? Absolutely easy. This is Tokyo classification. The differentiating point is severe, only presence of organ failure. And moderate, only local complications. When we did Atlanta in the class that I just took, local complications or transient organ failure. Transient organ failure, that was moderate acute pancreatitis, and severe was persistent organ failure. तो उतना ही फर्क है. Otherwise the classification are same. In fact, Tokyo classification is based on Atlanta classification only. Let's put it at that. पर इसमें रुकना नहीं पड़ेगा for 48 hours. You know on admission. Okay, you know on admission. Gallstone ileus is not included in Tokyo classification. Okay, because it's not a local complication, so it's not a part of Tokyo classification. Because in gallstone there is no cholecystitis. The cholecystitis is gone, so it's not a component of Tokyo classification. Tomorrow when I will take the integrated class which is at 4:30, I will put one question on Tokyo classification and I challenge you to give the answer of that challenge. Okay, I would have posted it on Telegram also, but I think it's a good question to be put in the special class. I will put a question on Tokyo classification because Tokyo abhi tak pucha nahi hai. It's a very virgin topic. Okay, so thank you for joining me. Tomorrow 4:30 p.m. I will take a special class on high yield topics including Tokyo classification beyond what we have discussed. Okay, beyond what we have discussed, do remember to like this video. If you guys missed my earlier video on pancreatitis, do see it, very short but interesting one. Please follow me on Telegram. This is my Telegram link, and remember to use my referral code 10surgery. Okay, so thank you for joining me guys. Have a good day.